Urbanization is a sign of progress of a society and also of the family. And this also brings about a lot of challenges, especially to the women folk, because women have a dual role to play. They have to sustain the family in their typical role as the food provider, provider for security, and bringing up newborn babies and furthering the society and the family. Well, at the same time, they are getting into very, very demanding jobs, and these jobs require them to be there with proper time management and then proper healthy approaches in their lifestyles as well as to the work. Now, such dual jobs are going to be demanding because they are absolutely getting on to the only 24-hour time span that the woman has. So she has to always constantly do the balancing act of trying to be the best on both the sides. Despite women getting into working, this particular role of women is still very, very underestimated and not well understood by the society and the family as well. And this causes then a lot of stress. So there is a physical stress because there is deprivation of food, sleep, and me time to just rejuvenate and recoil and come back. And there is also a deprivation of having help in some form or the other where she can be able to perform better at work. Now, when these two things come together, she definitely gets anxious. Mental anxiousness is too much, and then those pressures can break the woman down. Before that, there will be subtle presentations like she will suffer from obesity, anemia, hypothyroidism, lack of sleep. Lack of sleep causes huge amount of hormonal disruptions which can challenge her ovulation, pregnancy potential, and so many other things. And these require to be understood, and therefore these kind of acts, wherein she'll be able to be guided, where she will understand, where she'll be able to take care of these things would help her much better. But these complications would finally get into an increase in rise of thyroid dysfunctions, diabetes, blood pressure complications. I had never seen so much of blood pressure rise in young women coming for pregnancy or pregnancy planning 10 years back. But now we are seeing them in a large amount. Then they have other musculoskeletal disorders such as lack of strength. Even if they are just in the early parts of their pregnancy, they'll start having leg aches, leg pains. And today there's huge amount of data which talks about leg cramps or leg pains are actually sign of depression. And this is something that we are not realizing. So they are suffering from many kind of nutritional deprivations, challenges, and on that now they also have a pressure of embarking into a family because there's always that fear that if I delay it further, then I will lose my fertility potential and then I will not be able to make healthy babies, there will be abnormal babies and so on and so forth. So pregnancy complications in urbanization are an entirely different ball game which require very, very structured and a special kind of an approach, and women are very intelligent and therefore this can be dealt with very, very smartly.